Did you end up finding some blood in your urine? Should you be concerned? Also, what are some of the most common causes of blood in the urine? Those are all really good questions to have because blood in the urine, also called hematuria, can be a very mild concern or it can be a life-threatening concern. Understanding the various causes of blood in the urine is very important because all people with hematuria should seek medical attention as soon as possible to not only get it identified but also treated accordingly. We also need to be looking out for our family members because if they're complaining about blood in the urine, you need to let them know that's not normal and they need to get evaluated as soon as possible by their provider. With that being said, let's talk about the top 5 causes of blood in urine. Boom. Hey everyone, welcome back to Hawk's Health. Thanks for watching. If you're interested in elevating my channel and keeping this ball rolling, consider liking and subscribing below. Also stay to the end because I'm going to talk about some bonus information that you'll definitely want to know. Before we dive into the causes of blood in the urine, we need to first understand the anatomy of the urinary tract. By understanding the urinary system, we're able to kind of pinpoint where that bleeding is, and that can kind of match with the causes of blood in the urine. So the urinary system consists of the kidneys, the ureters, the bladder, and the urethra. Although the prostate is not technically part of the urinary system, it's part of the male reproductive system, men have prostates and we need to know where they're located because prostate issues can cause blood in the urine. But the prostate is a walnut-shaped structure just below the bladder and it surrounds the urethra. As a man gets older, they're more prone to getting prostate swelling, also called BPH, also called benign prostatic hyperplasia. Also, young and old men could get prostatitis. So now that we got a brief overview of the urinary system, let's dive into the top 5 causes of blood in the urine. Number 1, urinary tract infections, also called UTIs. UTIs can cause inflammation all along the urinary tract depending on where the infection is located. For example, you could have bleeding from the bladder due to a bladder infection, also called acute cystitis. You could also have bleeding from the kidneys from a kidney infection, also called pyelonephritis. With these infections, the bacteria causes significant damage and inflammation of the urinary tract, and this could lead to blood in the urine. But remember, not all UTIs will have blood in the urine, but it can occur. But UTIs are actually one of the most common causes of blood in the urine. The good news is these infections typically go away with the appropriate antibiotic regimen, and the hematuria should gradually resolve. Yet keep in mind, pyelonephritis, the kidney infection, is a major issue and could be life-threatening. So if anybody is having back pain, fever, blood in the urine, anything like that, they need to get seen as soon as possible and get treated ASAP. And if you're interested in getting more information about UTIs, check out my videos above. The second top cause of blood in the urine is prostatitis, or also an enlarged prostate, also called BPH. Again, the prostate is that walnut-shaped structure just below the bladder and it surrounds the urethra. When the prostate becomes swollen from BPH or prostatitis, which is an infection of the prostate, this could lead to too much inflammation and damage along that urethra and prostate, and that could lead to blood in the urine. If a man develops BPH or prostatitis, the good news is these can be treated or managed appropriately, and the hematuria could go away with time. So if a man is having urinary frequency, urinary urgency, nocturia, if they're having a fever, groin pain, if they're trying to start a stream and they're straining, those could all be signs of prostate issues that need to be addressed as soon as possible. Number 3, kidney stones. As you could imagine, kidney stones can cause significant damage all along the urinary tract. Kidney stones can be caused by a variety of reasons. Sometimes people are just predispositioned to getting kidney stones. They could become dehydrated and develop a kidney stone. And sometimes people's diet contributes to kidney stones. Ultimately, the stones can develop in the kidneys and also in the bladder. And these stones can become so hard and so large where they block a ureter or both ureters or even the urethra. But they typically only become painful when they start migrating, once they start moving down the urinary tract. That's why sometimes we'll get a CT or a picture of the abdomen and we'll see stones in the kidneys themselves, but the patient's not having any pain. Because like I said, it's not painful yet because those stones haven't started migrating down the urinary tract. On the other hand, Sometimes stones can be so small and not very spiculated at all that they don't cause any pain and people pass them without even knowing. But if those stones are large enough and abrasive enough, that can cause significant trauma along the urinary tract, along those ureters, the bladder, and the urethra, which can lead to blood in the urine. Most stones pass on their own and the hematuria will resolve. On the other hand, they can be so large where they occlude the ureters or the urethra and require further intervention. Number 4, urinary tract tumors. Various urinary tract tumors, benign in nature, meaning non-cancerous, and malignant in nature, meaning cancerous, could cause blood in the urine. Bladder cancer, for example, is a major issue, and some risk factors for bladder cancer is individuals over the age of 65, and also individuals who are long-term smokers are more at risk of developing bladder cancer. It is so common in smokers, in fact, that around 60% of people, I repeat that, 60% of people with bladder cancer were smokers. And another interesting thing is a lot of people with bladder cancer typically present with just hematuria, just blood in the urine with no other symptoms. So if somebody is over the age of 65, they're a long-term smoker, and they have blood in the urine, the hair on the back of somebody's neck should stand up and they should be concerned about potential bladder cancer. On the other hand, you gotta remember that bladder cancer can still be seen in younger individuals and individuals who don't smoke, but it's just much more rare. Number 5, exercise. Blood in the urine can also be seen due to excessive exercise, and we see this a lot in our long distance runners. The cause is not definitive, but the thought process is due to that repetitive trauma while running irritates the bladder, causing a little bit of blood in the urine. With these long distance runners, usually the hematuria is a very mild amount and they don't have any other symptoms. Typically, the hematuria usually goes away in about a week's time. On the other hand, any runner or athlete who develops hematuria, they don't want to ignore this issue. They need to get evaluated first to rule out all the bad stuff. Also, somebody could develop what's called rhabdomyolysis from excessive exercise as well, but their urine tends to look more coca color in appearance. Rhabdomyolysis can also present with muscle pain, muscle cramping, significant fatigue, and this is something that we don't want to mess around with because rhabdomyolysis can cause long-term kidney damage. Once again, I'm going to reiterate this. If anybody has any blood in the urine after exercise, don't assume it's just going to go away. Always see your healthcare provider. Now on to the bonus causes of blood in the urine. Kidney disease. With various kidney diseases like glomerulonephritis, a lot of times patients don't see any blood in their urine, and how we find out that blood is in urine is through urinalysis. So somebody gives us a urine sample, we test it, and find out that there's red blood cells in the urine. Glomerulonephritis is when those filters in the kidneys become inflamed and irritated, and sometimes they can bleed a minimal amount. Next bonus cause of blood in the urine is from a kidney injury, and this may seem like common sense, but any trauma to the kidneys could cause blood to be in the urine. We see this more often with our contact sports, so our rugby players, our football players, our boxers, our MMA fighters, but we could also see this during motor vehicle accidents. All right, last bonus cause of blood in the urine is medications. Different medications that could cause blood to be in the urine is certain penicillins, cyclophosphamide, heparin, and even certain NSAIDs like aspirin. But remember that these medications don't typically cause blood to be in the urine. It's actually very rare. So never abruptly stop taking these medications because for some people, these are important medications to take daily. So always consult with your healthcare provider prior to stopping any medications. Lastly, the main thing I want you to get from this video is blood in the urine is abnormal. So if you have blood in the urine, definitely schedule a visit with your healthcare provider as soon as possible. Overall, that wraps up today's video on blood and urine. I hope you learned a thing or two. If you did, please consider liking and subscribing below. Otherwise, until next time.